Erica was one of my clients who had been under my care for just over 3 years during my formative years of working as a psychiatrist. And at a time when I thought Erica was doing well, I got this call from Erica's mother to tell me that Erica had taken her own life. The reason why Erica's mother couldn't come to the hospital with Erica was because Erica and her parents didn't have the $10 bus fare to get onto a bus to come to the hospital. And so I immediately started thinking, there has to be a way of taking mental health to the community. I didn't know what it was going to be, but that was really the beginning of the work that I do. In Zimbabwe, we have on average 1 psychiatrist for every 1.5 million people. After the tragedy of Erica, I came across these amazing grandmothers in a community close to the hospital where I worked. And I realized they are the custodians of the local culture, and they could very well be the entry point to evidence-based care in communities across the country. The 14 grandmothers were the first people I opened up to about Erica's death. The first thing that they did was pray for me. They broke into this soothing, melodic Shona song, which led me to just break down in tears. And after that, there was just silence. That actually resulted in me being able to talk freely about Erica's death. My understanding of psychiatry was really based on the education that I had received as a psychiatrist. The grandmothers, they changed the way I think about therapy. Friendship Bench is a brief psychological therapy delivered by trained community grandmothers from wooden park benches across Zimbabwe and beyond. I started off with 14 grandmothers who I trained in the basics of cognitive behavioral therapy. How do you use your eyes when you're engaging another person on the bench? How do you use silence? It's not about identifying a person's diagnosis. In essence, the actual therapy is really about getting people to talk. Now, in Zimbabwe alone, we have over 2,000 grandmothers. The grandmothers always say this work gives them that sense of belonging and gives them a sense of purpose in their communities. Grandmothers who are involved with Friendship Bench are less likely to suffer from non-communicable diseases such as hypertension and diabetes. And they also have a very low rate of what we call common mental disorders. My ultimate vision is to scale Friendship Bench through our scale strategy, which we call the Friendship Bench in a Box, a DIY toolkit which brings together all the lessons that we have acquired. We've just done that in Washington, D.C. We're about to do the same in New Orleans. We found that the grandmas in Washington, D.C. have the same characteristics as the grandmas in Zimbabwe. But I would say that the most important thing about the work we do on the Friendship Bench is really creating that space for people to tell their stories. Because over the years, we've realized that when people begin to talk, that's when healing begins. My name is Dixon Chibanda. This is my brief but spectacular take on healing communities through stories.